So ischemia. Whenever there is a deficient blood supply to a part of a tissue, be it any organ, it is called as ischemia. The word ischemia has two parts. That is isch. The first part is isch. That is suppression of suppression. That means suppression, and emia, it indicates blood. So there is a kind of suppression of blood, and due to the lack of blood supply to a particular tissue, that tissue dies off, and this lack of blood supply is called as ischemia. And depending on the extent of the block that is present in the vessels, it can be a complete ischemia or a partial ischemia. And the adverse effect of ischemia, it results in, it occurs in three ways. The main adverse effect occurring in ischemia is hypoxia. That is, whenever the blood supply is deficient, it means the area is not getting enough oxygen to survive. So hypoxia is the first adverse effect that occurs whenever there is a blockage of blood. So there is a deprivation of oxygen to the tissues, and it can be of four types. Hypoxia, that is hypoxic hypoxia. That means there is a low oxygen concentration in the blood. Then hypemic or anemic hypoxia, that is there is a low, whenever there is a low hemoglobin concentration in the blood, again oxygen supply reduces. Then another is stagnant hypoxia, that is there is inadequate blood supply due to reduced pumping or reduced output. The blood stagnates, and it gets stagnated in the heart, and organs won't be getting the proper blood supply. That is inadequate blood supply. It can lead to hypoxia. Then the last one is histotoxic hypoxia. That means maybe due to some kind of cellular toxicity is present, and the oxygen uptake is decreased. That means the oxygen supply may be present, but due to some kind of cellular toxicity, it usually occurs in kinds of cyanide poisoning, etc., or many other kinds of poisonings. There is cellular toxicity, and this toxicity prevents the uptake of oxygen. Even though oxygen is present, the uptake of oxygen is reduced. That is called as histotoxic hypoxia. Next thing what happens is due to inadequate blood supply is the malnourishment of cells. That means if the blood supply is less, that means supply of nutrients is also less, like glucose and amino acids, it's necessary for body's metabolism. And as a result of it, there is a decreased metabolism and other cellular activities in the body, which is essential for the growth of the cells, of proper functioning of the cells. And the third one is inadequate clearance of metabolites. If at all any metabolisms happen, there will be waste products. And if there is no proper blood supply, there is a accumulation of those waste products in the blood. So these are the adverse effects of ischemia. And when we consider the causes of ischemia, the primary cause is from the disorders or any abnormalities in the heart. It can be a decreased cardiac output due to some kind of blocks, maybe due to a thrombus or emboli, which obstructs the circulation, or due to any vasculopathies or vessel wall defects or something like that. Whenever there is a decreased cardiac output, it can lead to ischemia anywhere in the body. Then ventricular arrest is another condition, of the cardiac arrest, as we usually say, due to the electrical malfunctioning of the heart's electrical system. What happens is that suddenly the heart muscles stops beating, and lead to a condition called as cardiac arrest, and there is again the cardiac output is hampered. Or fibrillation. Fibrillation is the abnormal movement or rhythm, or the improper rhythm of beating, again due to electrical disturbances. That fibrillation occurs, there is stagnation of blood in the body, in the heart, leading to decreased output again. All these causes hypoxic injury to the brain. If the arrest continues to 15 seconds, there will be loss of consciousness, and if more than 4 minutes, there is an irreversible ischemic damage to the brain. It starts happening step by step. And about more than 8 to 10 minutes, if the cardiac arrest continues, it causes death. There are more chances of the patient to die. But in between, if we are doing any CPR, etc., there are chances of extending damages. So the next is pathologies occurring in the arteries, which is the most considered as the most commonest of the causes of ischemia. There can be lumen occlusion. The lumen of the blood vessel can be occluded or blocked by presence of a thrombus or an emboli. I'll be explaining it in detail later. Thrombus or emboli, or from the any abnormalities in the arterial walls. That means vasospasm. Spasm means constriction. So then there is a repeated vasoconstriction of blood vessels, constriction occurring in blood vessel. It leads to vasospasm of the blood vessel, leading to decreased blood supply. And then hypothermia. Again, hypothermia. Again, the temperature is decreased. In extreme cold conditions, there will be severe vasoconstriction leading to decreased blood supply. In arteriosclerosis, again, that is also again a kind of sclerosis or kind of obstruction that occurs inside the blood vessels. I'll be dealing it with later. Atherosclerosis or arteriosclerosis. Then Berger's disease. Berger's disease is also a clot, presence of clots. It's also called as thromboangiitis obliterans, occurring due to excess use of tobacco, etc. It can lead to clot formation in the blood vessels, leading to decreased blood supply to a particular part, followed by gangrene, formation of gangrene of that particular part. That is Berger's disease. And also trauma, different kind of trauma and injuries can also lead to decreased blood supply. Then outside pressures like ligatures, tourniquets, and bandages, when tied with increased pressure, it can decrease the blood supply. And it can, ischemia can also occur due to pathologies occur in the veins. In the lumen, again, the thrombosis can occur. The vessel walls, there is the varicose veins. That's the veins contains valves, and any defect in the valves can lead to improper blood supply, pushing of the blood towards the heart, leading to varicose veins and decreased blood supply. Then outside pressure, like any strangulated hernia. So whenever there is a hernia, and in a hernia, if the blood supply is cut off, it is called as a strangulated hernia. Then intersusception, or I think I have dealt in Udara chapter, intersusception and volvulus and Bathagudodara. There is again the telescoping of the intestinal segments over one another, leading to decreased blood supply of the arteries, minute arterioles, etc. present in that area. Also volvulus, that's the twisting of the intestine, leading to decreased blood supply. So all these are the causes of ischemia. Now we just see the effects of ischemia. That is usually when there is a lack of blood supply, usually collaterals are formed, collateral circulation or new blood vessels are formed which bypasses the blocked blood vessels. So in such case, if proper collaterals are formed, usually there is no much adverse effects in ischemia. But if proper collaterals are not present, functional disturbances, many adverse effects starting from functional disturbances to sudden death can occur. Functional disturbances includes pain, that is represented with pain. There is angina, or chest pain or etc. Then intermittent claudication, that is pain on exercise and relieved on rest. Since there is a lack of blood supply towards the cells, when we move about or walk or run or do exercise, there is inadequate blood supply to the muscles, which leads to pain, and it gets relieved on rest. This is a sign of ischemia. Then cellular changes might, different kinds of cellular changes are also seen. That is a necrosis of the tissue. Necrosis means death or sloughing off of the cells, of the cells becoming dead. Then ischemic atrophy can be there, or wasting. Atrophy is wasting of the cells and tissues due to lack of blood supply. Also replacement fibrosis can occur in any organs. That means the dead cells are being replaced by new cells, or scar formation in the cells. And the major effect is death. Our next topic is infarction. So infarction, that means it's a process of tissue necrosis resulting from some form of circulatory insufficiency. And again, circulatory insufficiency is indicating presence of ischemia. If there is ischemia or lack of blood supply to a particular organ or a tissue, the cells die off, and that dead area of cells is called as an infarcted area or an infarct. So for example, if it is in the heart, it is a myocardial infarction, and if that dead area is in the lungs, it is a pulmonary infarction. If it is in the kidney, it's a renal infarction. So totally that localized area of necrosis is called as an infarct. The etiology of infection, again, all causes are mentioned in the ischemia, is also the reason for infarct. Okay, so sudden, complete and continuous occlusion produces infarct. So sudden, complete. I had mentioned partial ischemia and complete ischemia. So when there is a complete ischemia, there is a total loss of blood to that tissue area. That leads to, and it's a continuous process. For a long time, there is no blood supply to a particular area, and that causes the area to be dead. The cells will not be receiving enough oxygen or blood, and it becomes dead, and that area is called as an infarct. Then we come to the types of infarction. The first type is the white, pale or anemic infarction, and that is arterial occlusion occurring in solid organs like spleen, kidneys or heart. And when infected area in such organs, solid organs, the area will be white, pale or anemic. That's called as a white infarct area. That is the first type. And the second one is the red or hemorrhagic. It's usually red infarct area or hemorrhagic infarct area is usually found in soft and loose tissues by pulmonary artery. That is any kind of obstruction in the lungs. So more soft tissue. So the infarct area can be seen as a red or hemorrhagic clots. And according to age again, if it is new, it is a recent or fresh infarct. Or if it is an old one, it's an old or a healed infarct. Then again, according to infection, if infection is absent, it is called as a bland infection. And if infection or bacterial contamination is present, it is called as a septic infection. So we'll go through the pathophysiology of an infarct. Usually a localized hyperemia due to local anoxemia. Anoxemia is the deprivation of complete oxygen, lack of oxygen supply. And this will trigger a normal response from the body causing a localized hyperemia, means increased blood supply to that area to compensate it. That occurs immediately after the obstruction of a blood supply. It's the body's natural mechanism. So localized hyperemia arises to that area to supply more blood. But it fails, it slows down slowly in few hours. Slowly due to that hyperemia, there is formation of edema and mild hemorrhage. which causes swelling in that affected area. So in about 12 to 48 hours, cellular changes, irreversible cellular changes started appearing. That shows the manifestation of necrosis of that affected area. So there is a proteolysis or breakdown of the proteins present in the tissues, and the red cells are also broken down. There is a lysis of red cells. All these are a part of acute inflammatory reaction which happens as soon as this process occurs within 1 or 2 days, that is within 48 hours to 3 days, up to 3 days. There is an acute inflammatory reaction and hyperemia leading to all these kind of changes. So after that, the inflammation becomes chronic. So the acute stage ends. So in that stage, up to 7 days, within 7 days, we can see changes like blood pigments and hemosiderin is liberated, because the RBC is already broken down. So all the blood pigments and hemosiderin is liberated by lysis of RBC. They are deposited in the infarct, and it appears that it's as a red granulation tissue around the pale or yellow. By 7 days, that infected area would have changed color from pale to yellow, and around the yellow necrotic area there is a red granulation tissue. That this kind of manifestation occur about 7 days, and after that it is a progressive ingrowth of granulation tissue, or a healing is occurring. There's a progressive ingrowth of granulation tissue from the margin of the infarct. That is the healing process is going on, and it is replaced by fibrous scar in 2 months. Fibrous scar is formed. That means a infarct area is healed. So again, the fibrous scar, if it is large in size, the scar formation is more large in size or more thick, again it leads to further congestion of the area. So it can create complications. So this is a rough pathophysiology of what is occurring in an infarct. So we'll just go through a few pathological changes that is occurring, and usually it's a wedge shape. The infarcts of solid organs, each appears as that area appears as a wedge shape. Wedge means an area that is almost triangular in area with a pointed apex and a wide base. So the area of infarct is usually a wedge shaped, and the apex of the wedge is the part where there is the occlusion of the artery, and from there it gives a wide base. It follows a diverges to a formation of a wide base, forming a triangle shaped wedge area of infarct. So the apex is pointing towards the occluded artery and a wide base on the surface of the organ. And infarcts due to the arterial occlusion is usually pale, and venous obstruction is usually hemorrhagic or appear as the red. The most infarcts usually becomes pale later as the red cells are lysed, but pulmonary infarcts never become pale due to extensive amount of blood present in the area. Also, recent infarct, as I told earlier, it appears as slightly elevated over the surface, whereas an old infarct is shrunken, depressed under the surface of the organ. Now we will just see certain factors influencing the development of an infarct. The first one is nature of blood supply. So here there is dual supply and endarterial supply. So dual supply means that particular organ is supplied by has got another two different arteries, or another circulation is present. So any obstruction caused by one of it gets compensated by others, so there is a less chance of formation of infarct. So dual supply is usually seen in lungs. Here there is an additional supply from the bronchial arteries, and the liver there is both hepatic and portal circulation. Then hands and forearm, they are supplied by the radial and ulnar. So any one of the artery will be patent. That leads to less chance of formation of infarct in these areas. So the nature of blood supply depends on dual supply. Presence of dual supply that decreases the chance of formation of an infarct. Whereas the end arterial, that means that organ is supplied by an end of an artery. That means single artery is supplying to that organ. So like spleen and kidneys, there are more chances. If there is a splenic infarct, that means the spleen, the blood supply to the spleen is cut off, and then kidney, again the renal supply is cut off. It is more chances are there because it is a single supply coming to these organs. The next part is rate of occlusion. Rate of occlusion is another factor. So if the rate of occlusion is rapid, that means there is a quick manifestation of a infarct. Whereas the rate of occlusion, if it is a gradual, it takes time. If it takes time, like an atherosclerosis of coronary artery, it's a gradual process. It takes days, months. So it's a slow formation. So there's a chance, there's a time for the collaterals to develop. So that can bypass the occluded artery and give enough circulation to the area. So there's a gradual occlusion can produce a slow formation of a necrotic area due to the presence of the collaterals. So next point is the vulnerability of that area to hypoxia. Our body parts are different area responds in different way to hypoxia. For example, neurons or the brains in the brain can withstand up to 3 to 4 minutes of hypoxia, whereas the myocardial cells of the heart, it is 20 to 30 minutes it can sustain with hypoxia. Even fibrous tissue, it can live for hours. It can stay for hours without oxygen supply, enough oxygen supply. So vulnerability to hypoxia is another factor leading to the manifestation of an infarct. And the last factor is the oxygen content of the blood, or the hypoxemia. Oxygen content in the blood. So hypoxemia. Emia is indicating the blood, and hypoxia is the decrease of oxygen. So the more the hypoxemia, that means there is less increased oxygen in the blood, there is a more increased chance of infarction. Okay, so more the hypoxemia, there is a more chance of and severity of the infarction. Usually heart failure patients, when tested at having a low oxygen concentration in the blood, that low oxygen concentration in the blood is the reason for that heart failure. So these are the factors which are influencing the development of an infarct. Now we will just see the examples. We made infarcts of different organs, their gross appearance and their outcome. So myocardial infarction is the main one, that is appearance is pale usually, and it is frequently lethal, means it can bring about death. Then pulmonary infarction, it is a hemorrhagic type or red infarct in the loose tissues there. It is less commonly fatal because lungs is having a dual circulation, I told earlier, so it can sustain. Cerebral infarction, usually it is hemorrhagic and pale depending on the area. If it is a massive cerebral infection, it is fatal. It can bring about death. Or what we call is stroke, that is stroke occurs due to this cerebral infection, can bring about stroke. Then intestinal infection, again it is hemorrhagic and it is frequently lethal. Renal infection, it is pale infection and it is not that much lethal unless it is massive and bilateral. So in kidneys, both kidneys are there, so if there is an infection in both kidneys only, there is chance of death of the person. One kidney is affected, it is not that much severe condition, the other can sustain it. So the infarct of the spleen, again it is pale and it's not that much lethal. Infarct of liver is also pale and not lethal. Infarct of the lower extremities also, it's pale and not lethal.